As healthcare professionals, it's important that we are cognizant of our obligations under the HIPAA laws, as well as the ramifications, personal ramifications, for not being compliant. I'd like to share with you 3 stories of different healthcare workers who landed in hot water. The first story dates back to 2003. A research worker at UCLA had been terminated from his position, and 3 weeks prior to leaving the organization, he accessed the records of high-profile movie stars, and he actually accessed the records 323 times. Well, this ended up landing him 4 misdemeanors, 4 months in a federal prison, and $2,000 fine for violation. How do they find out, you might wonder? Well, we're required to conduct audit trails to know who's been in the patient records when. And obviously, as a research worker, he was not entitled to be in the records of those individuals where he snooped. The second story is about a nurse who was taking care of a pediatric patient who had the measles. This particular patient had not been vaccinated. And it just so happens this nurse shared the philosophy of not having vaccinations. So she belonged to a private Facebook page for non-vaccinators. She was posting her experience in taking care of this child since she had never seen someone with an active case of measles. Bear in mind, she did not post the patient's name, date of birth, or a picture of the patient. By simply expressing her feelings and the care that she rendered to this patient, she wound up getting fired from her job for violation of company policies and procedures. The third story is about a nurse in New York who took a patient list from a practice and ended up getting her former employer in hot water with HIPAA. Before she left the practice, she asked for a list of all of her patients, allegedly so she could ensure all of her clinic notes and everything were up to date. She did not return that list, but took it with her to her new employer, where they proceeded to notify 3,400 patients by mail that they could continue care with their nurse practitioner at this new location. The former employer became aware of this when a patient called to notify them. Uh-oh, this is a HIPAA breach. We have 3,400 patients' information that was being used by someone else and had been disclosed without authorization. So as a result, the former employer is the one that landed in hot water for not recouping that list of patients from her. And they were fined $15,000 under the federal law. Well, the nurse didn't get by so easy herself. She ended up being sanctioned by the New York Nursing Board. So as professionals, it's important that we're aware of our legal obligations to protect patient confidentiality, remain careful with authorized and unauthorized disclosure of information, and know your obligations under the law.